This video was made to help caregivers understand what to do when their child gets diarrhea. It will help them understand what diarrhea is and how it can be managed at home. Just remember, if you're ever worried about your child or the suggestions in this video aren't working, you should take your child to see a doctor, nurse, or other healthcare professional. What is diarrhea? Diarrhea is when people have loose, watery poops, and usually lots of them. It typically lasts for less than a week and can sometimes come with vomiting. Children can also have fever, loss of appetite, and stomach pains. Most diarrhea is caused by viruses that pass from person to person. The best way to prevent the spread of diarrhea viruses is to ensure that everyone has good hand washing and food is handled and cooked safely. Unfortunately, there is no medication that can make diarrhea go away early. Because diarrhea is usually caused by a virus, antibiotics won't help. In fact, they can cause diarrhea or even make it worse. Other medication available at the pharmacy that says it can treat diarrhea should be used with caution, as some of them are not safe in kids. They should only be given under the advice of a healthcare specialist. There are two major problems that can be caused by diarrhea: dehydration and problems with salt imbalances or electrolyte imbalances in the body. Most of the time, both of these problems can be managed safely at home. Here's what you can do. Dealing with dehydration. If your baby is breastfed or formula fed, continue to feed your baby as you would before they got sick. There is no need to dilute formula or give extra water. This can actually be dangerous and should be avoided. If your child doesn't take breast milk or formula, you can replace the fluid with a special oral rehydration solution. If your baby is less than 2 years old, oral rehydration solution that is available at any pharmacy is the safest option because it has all the ingredients to replace all the water and salt that your baby is losing. If you're having trouble finding it or aren't sure what to buy, then ask the pharmacy staff. They should be happy to help. You can buy oral rehydration solution without a prescription. If your child is older than 2 years, oral rehydration solution will still work well to rehydrate them, but they can also take water, soup, or other liquids that aren't too high in sugar, like juice or soda. You may find recipes online telling you how to make oral rehydration solution. It is recommended not to use these solutions because mistakes in mixing them or solutions that aren't properly balanced are common. The solution at the pharmacy is the safest option. It is important to monitor for signs of dehydration because it can be very dangerous, especially for babies and toddlers. If your baby has less than 4 wet diapers in 24 hours or older children go more than 8 hours without peeing, then they're probably dehydrated and may need to see a doctor or healthcare specialist to help get them back to the right amount of fluid level. Other signs of dehydration include dry mouth or absence of tears when crying. If your child has sunken eyes or sunken soft spot or fontanelle on their head, or their heart is beating faster than usual, these are all signs of dehydration and mean that it is important to replace their fluid loss. If this happens, they should see a doctor. Electrolyte imbalances. When rehydrating your child, it is important to remember that the salts that they lose in their poo is just as important as the fluid. This is why it's important to not just give them water. They need oral rehydration solution, milk, or food to replace the salt and sugar that they lost. If your child is willing to eat, it's a good idea to keep feeding them. Avoid sugary drinks like soda or juice because the high sugar levels in these drinks can actually make the diarrhea worse. How to give oral rehydration solution. When babies and children are throwing up, it can make it difficult for them to keep down large amounts of fluid. The best way to allow them to absorb the fluid without throwing up is to give small amounts of fluid often. It is suggested to give approximately 1 teaspoon of fluid every 5 minutes to start. If it's hard to get this fluid in, it can be given with a medicine dropper or a syringe. Babies less than 6 months old should get a total of 1 to 3 ounces or 30 to 90 milliliters of fluid every hour. Kids 6 months to 2 years old should get 3 to 4 ounces, 80 to 120 milliliters per hour. Kids older than 2 years need 4 to 8 ounces or 125 to 250 milliliters of fluid per hour when they're mildly dehydrated. This plan should be continued for at least 4 hours or until your child's diarrhea and vomiting improves. It is safe to give babies and children only oral rehydration solution while they're sick with diarrhea. When they get better, they will move back to eating milk and solid food again, even if this takes a couple of days. You should restart them on their regular food as soon as they can take it. When should you see a doctor? If your child is less than 6 months of age, they are at higher risk of getting dehydrated quickly and therefore should see a doctor for vomiting and diarrhea. Any child less than 3 months who has a fever greater than 38 degrees Celsius or 100.4 degrees Fahrenheit for any reason should be seen by a doctor. Any child who appears dehydrated based on the signs discussed before should also be seen to make sure that they have their fluids topped up before keeping them hydrated with oral rehydration solution at home. If there is any blood or black color in your child's diarrhea or vomit, they should be seen by a doctor right away. If there is bright, fluorescent green vomit without your child eating green food, they should also be seen. If your child has progressively worsening stomach pain that doesn't seem to get better, or the pain is made worse by jumping up and down, they should be seen by a doctor as well. Remember, anytime you're worried, you should not feel guilty about seeing a doctor. Parents know their children best and know when they are sick enough that they need to be seen. Hopefully this video helps keep caregivers and children happy and safe when they're sick. Remember, anyone can get diarrhea, and if your child has it, there's a good chance that you might get it too. These instructions are also good for big kids and parents. Anytime you're worried or think that something just isn't right, please see a doctor or other healthcare professional.